Hello, my name's Chris Thorne and I'm the head of the clinical negligence team at Clark Wilmot.
Hello, I'm Marguarita Tyne and I'm a clinical negligence partner with Clark Wilmot.
And today we thought we'd discuss a subject that isn't much talked about in the clinical negligence field, and that's the issue of fertility, or more precisely, loss of fertility. The instinct, the desire, the drive to have a child is something that is present in most people. Now, some people may make a rational choice that they don't want to have children, but if that choice is taken away from you by a third party, by somebody else's negligence, the impact can be devastating. And that can arise in a number of ways in cases that we deal with. So, Marguarita, I think you've had more experience than I in dealing with loss of fertility arising from cancer cases.
Yes, that's right. So it can arise in different scenarios. Most commonly, probably, are cervical cancer cases and delays in identifying that a patient has cervical cancer. It's very treatable if it's in the precancerous stage, and fertility will be entirely preserved, and many women go on to have successful pregnancies. But if the cytology or cervical smears are not interpreted properly and a cancer is allowed to develop, then that could give rise to a claim. Similarly, there might be claims arising as a consequence of a delay in diagnosis of womb cancer, and if that's in a woman who is still of childbearing age, and there's been a delay and they have to have a hysterectomy, losing their fertility, then obviously that's going to be devastating. So these are quite complicated cases. We have to investigate them really carefully. We have to get experts to tell us what could or should have been spotted at an earlier stage, and we have to have an idea of prognosis. And in some cancers it can be an aggressive cancer. In other cases there can be all sorts of reasons why the clinicians might be excused not having spotted what they what becomes apparent later. So they're not straightforward, but in cases where we can establish fault on the part of clinicians, then we can recover significant awards, and potentially after a recent case we may be able to also include the costs of commercial surrogacy agreements overseas. So they're fairly substantial in terms of damages. In terms of cases involving male fertility or infertility, they will be cases of delayed diagnosis of testicular cancer, and they can be equally complex. So that's a bit of a skip through my experience. Chris, your experience is fairly different. You have dealt with a number, I think, of testicular torsion cases and cases involving cryopreservation and IVF. So maybe you could talk a little bit about those.
Yeah, sure. And you're right, whatever the cause, the outcome is equally devastating for the families involved. So testicular torsion is what it says, where a testicle becomes twisted in the scrotum, loses the blood supply and fertility is lost. And that can happen particularly amongst young men, and is quite often missed by GPs in an early stage, causing the loss of the testicle altogether. Again, potentially devastating effect. The alternative cause that you've just mentioned, Marguarita, is IVF and cryopreservation cases, and these are unusual, fortunately, and it is something in which we have fairly unique experience. But if you've already had the difficulty of finding that you can't conceive by natural means, you may well have opted for IVF. You may well have stored sperm or eggs or embryos in a storage facility, and they may be inadvertently lost or damaged, and that may prevent you having the child that you hope to have, and that too can give rise to a claim. And as you mentioned earlier, all of these claims can be complex, but given the impact upon families are important. It's a loss that's deeply felt. So that's a very brief run through of the sort of claims we do. In terms of the IVF side of things, we also, again fairly uniquely, have a colleague in our family law team, Sarah Woodheath, who deals with surrogacy issues and steps leading up to IVF treatment. Anything else we ought to add at this stage, Marguarita?
I think you have covered quite a lot of ground there and highlighted really the essential issues of this really devastating area for many of our clients.
Okay, well, thank you. Hopefully that's given you a little insight on what we can do. And clearly, if you feel that you might have a claim of this type, get in touch with either of us. Feel free to discuss it. Our details are on the website, and we'll always be happy to have a chat. Thank you very much.